A day in the life of Californian Michael Somm, a terminally ill cancer patient.
It's nonstop. It's just constant pain. It's constant headaches, just pounding headaches, nonstop nausea. I'm constantly nauseated. And when I'm not nauseated, I have pain in my stomach.
Do you cry?
Yes. It gets so severe that I do cry.
Michael wakes up hoping that the state and then a doctor will legally help him to end his life.
I don't want to die. That's not it. I love life and I want to live. This is the happiest I've been in my entire life, and now they tell me I'm going to die. And to that, I say I have a death sentence, so why not just end it early?
Some legislators in California are asking the very same question in the form of State Senate Bill 128.
SB 128 is legislation that would allow patients to request a lethal dose of medication that a doctor would then prescribe.
Jason Doctor researches health policy and decision-making at the University of Southern California. He sees both sides of the issue as compelling.
For this legislation to go through and for doctors to practice physician-assisted suicide or aid in dying, they would either have to go against the Hippocratic Oath, which would be to go against their public commitment to the community.
What did they say as justification?
Doctors in favor of this feel that they're helping to end suffering. They're shortening people's lives, but they're ending their suffering.
I would like to see all Americans have access to the same healthcare rights.
Last year, Californian Brittany Maynard poignantly chronicled online her own desire to end her life. Her public determination may have resurrected the dormant debate around this delicate issue. Maynard, terminally ill with brain cancer, moved to Oregon, one of 4 states, along with Montana, Vermont, and Washington, where physicians can legally prescribe a fatal dose of medication. She took her own life in November.
This issue really has to do with people being terrified of dying. If you listen to what Brittany Maynard had to say, and she's very sincere, so we have to ask, why is she terrified of dying, and what have we done with modern dying that has made it so terrifying? And can we make dying easier for people?
There's a difference between alleviating a person's suffering and eliminating the person who is suffering.
Dr. Ira Byock, a palliative care pioneer and author on books about dying, is the director of the Institute for Human Caring.
And there were certain limits imposed on the medical profession. The first of those is not to kill patients.
Byock, who is against SB 128, says the public fight should not be about accelerating death, but about fighting for better end-of-life care.
We will simply offer the people who are suffering an option to quickly and cheaply end their lives. This does not feel like social progress from my perspective. People should be born into the welcoming arms of society and die from the reluctant arms of society.
Michael Somm wants the progress to come from his being able to choose to legally end his own life.
I feel lucky to be able to do this.
It's funny, a lot of people would say, boy, you're the unluckiest person I've ever talked to.
Yeah, and I guess I am unlucky in that I have the cancer, but I'm lucky that I get to fight for this.
Michael Schur, Al Jazeera, Torrance, California.